Hi, Grandma. I heard you had some questions about pneumonia and respiratory illnesses, so I thought that I would answer a couple of your questions. I know that you asked what the leading cause of death in children worldwide is, and that would be preterm complications and developing pneumonia. And then some common signs of pneumonia include fever and dry cough and headache and just generalized weakness. Common hosts of Streptococcus pneumoniae include mice, rats, guinea pigs, the rhesus monkey, just other mammals. So there's quite a few hosts for that, for Streptococcus. Explain, identify how Streptococcus pneumoniae can survive outside the host in sputum. I'm not sure if I pronounced that correctly, Grandma, but it can actually survive outside of the host in sputum for about a week, in gauze from 2 to 15 days, and in a mouse carcass from 180 to about 270 days. So that's actually really surprising and really alarming, and just kind of goes to reinforce why we should always wash our hands and really be aware of the surfaces that we're touching, and then how that applies to touching maybe our eyes, putting our fingers in our mouth, chewing our nails. So just little things like that can really prevent contracting just such a devastating illness, especially in immunocompromised individuals. Identify the main causes of community-acquired bacteria. So that's going to be just bacteria in general, bacteria-like organisms, viruses. And then for treating pneumonia, amoxicillin and ampicillin are actually both good choices to treating strep throat or strep. And then we'll talk a little bit about respiratory illnesses. So the respiratory syncytial virus is actually it's common in children, but it just basically feels like a bad cold. I guess the name is a little more intimidating and daunting than what the virus actually is, but the symptoms are basically comparable to a really bad cold. And then identify the most common cause of bronchiolitis and pneumonia in children under 1 year of age within the United States. And again, that's going to be the respiratory syncytial virus, or RSV. And then risk factors for RSV actually include infants, so I guess less than 6 months in age. Also, infants that were born prematurely or have an underlying conditions such as congenital heart disease or lung disease, and then children with a weakened immune response. So these things all make sense, as this has always been a vulnerable population, and then to exacerbate, their issue by having a congenital disease or already having a compromised immune system, that can really exacerbate contracting a respiratory illness such as RSV. And then identify what % of children infected with RSV will develop severe respiratory symptoms. So that would actually fall between 0.5% and 3% of the population of children that infected with RSV who would experience a more severe form. So that's why it's really important to wash our hands at all times, cover our mouth when we cough, preferably with our elbows, just to kind of help protect and shield other people, other surfaces, and kind of clear the airways so that we're helping keep each other safe. So thank you, Grandma, for listening, and we'll talk soon. Bye.